Good morning, ladies and gentlemen. If you would, please, we have seats for many of you, so please come forward. And we will do our best to remain socially distant, but it's a pleasure to have all of you with us this morning. And man, it's a beautiful morning. This is what I love about Pueblo, Colorado, as we get a lot of days like this. So my name is Timothy Mote. I'm the president of Colorado State University Pueblo. For those of you I have not had an opportunity to meet, I would like to welcome you to our campus on behalf of the faculty, staff, and our students. And many of them I think are to my left. But it's a pleasure to have all of you with us this morning. This week is our convocation week. And it's a week where we devote to the professional development of our employees. And we're on day 4 of a very large week. It ends tomorrow, and we begin instruction on Monday. But the title of our convocation week is Life-Changing, Navigating Life in a Rapidly Changing World, which is the mission statement of the university. And I was sharing a few minutes ago on August 9th, when we revealed the new mission of the university to help students navigate life in a rapidly changing world, little did I know at that time that we would be tested as employees of the university. But it's a pleasure to have you with us today. I'd like to welcome some special guests with us, and they're going to have an opportunity, a few of them will have an opportunity to speak with you today. But we have Representative Danea Esgar with us. Glad to have you with us, Danea. We have Bob Binder from DLR. Bob is with us. Scott Robb from HW Houston. Thank you, Scott, for being with us. And we have the pleasure this morning of our first 2 doctoral students who have graduated from this institution. When you add a doctoral program to a university, it's a big deal in higher ed. And we are very delighted to have our 2 first doctoral students who graduated this past May with us. I'd like to ask them to stand. Dr. Katie Fechterle and Dr. Rhonda Orndorff. Both of these women will go down in the history of our university as our first 2 doctoral students. I'd also like to welcome to our campus today the partners. Our partners are very important to us, and we've got a great partner in Parkview Hospital. We have Renee Elwell with us and Leslie Barnes. Also today we have Stephen Trujillo from the Latino Chamber. Stephen, it's always good to have you with us. Phyllis Amor from the Greater Pueblo Chamber. Phyllis, thank you. We have Amy Gasparetti from the Pueblo West Chamber. Delighted to have you with us, Amy. And Ed Brown from the Pueblo City Council. Thank you, Ed, for being with us. I'd also like to thank my spouse, Rick Gonzalez, for being with us this morning as well. Thank you, Rick, for joining us. So we're about to begin a new and different and exciting year with a very new and different, exciting building that is to our site here. Today we celebrate the grand reopening of what was once known as our psychology building, and today the Center for Integrated Health and Human Inquiry. Our new facility is now home to our nationally ranked School of Nursing. We are ranked number 49th in the country, and there's a lot of schools of nursing. How many, Joe? Several. Dr. Francis said there's several schools, but we're 49th School of Nursing. And this building will also be home to our humanities and the social science academic departments that drive human inquiry on the campus. This is also a center that will take care of the health needs of our students and our employees. Both our health clinic and our counseling centers have been integrated into this facility. At a later date, we will celebrate a select group of donors who have generously contributed to specific rooms and spaces within this building. We'll be doing that at a later time. And we look forward to telling their stories and how their contributions will impact our faculty and students. Some people will say that it's not the building that's important, but it's the programming that occurs within the building that's important. I believe both are incredibly important. To become the People's University, we have recommitted ourselves to a set of values that drive how we teach and learn on this campus. Specifically, we value interdisciplinary learning and entrepreneurship that elevate our people and our community, create educational opportunities, and fostering unique collaborations. We could not have done this in the old psychology building. Of course, with some extra efforts, but the design and the features of our new center allows us to remain true to our values in a more natural manner. It's time to tell our story about the renovation of the center, and we begin with a woman who made it happen, Representative Danea Esgar. Danea served on the joint, Capital Development Committee, a committee that I visited a few times. Of our institution. She is responsible for representing, she does this very well, District 46. We're delighted to have her with us today. And I want to also just recognize two other individuals who approached Danea in the committee, and that was Vice President for Finance and Administration. I know he had gone to the joint, the Capital Development Committee on numerous occasions requesting funding for this project. He was accompanied by Craig Kaysen, who is also an integral part of our facilities plans on this campus. I just want to acknowledge both of them for their continued and persistent advocacy for this money. But I am ultimately grateful to Danea Esgar for allowing this project to become a reality. Ladies and gentlemen, Danea Esgar.
Thank you so much for inviting me here today, and I think you're giving me a little bit too much credit because it takes an entire team to get to that point. But just some background. This building was on the funding list for nearly over 10 years for the state to fund. And when I was brought onto the Capital Development Committee and we were going through all of the projects that were set to be funded, I saw this piece on there, and I said, wow, I remember that building when I went to school. In the very early 2000s, and how that building really needed to be updated. And I asked the question, why hasn't this building been brought forward? A lot of conversations on that committee, and a lot of it just happened to be that there wasn't enough representation on that committee to really push for it. So I started pushing for it. And I started having a lot of conversations with Carl and asking kind of the history. And finally, when I got down to it, I asked, what is the reason that we're not funding this project that has been on the state's list over a decade? And the answer was that there wasn't a school for this specific building. So then I started researching a little bit more and asked Carl, how much cash is the university using on other projects that they're not having to come ask the state for money for? And that was the game changer. When I brought that information forward to my fellow committee members, the other 5 of them, I started talking about what this building actually means for Southern Colorado, because I agree with you. The building is important, but it's what happens inside that's even more important. We know in Southern Colorado, access to healthcare is vitally important. And if we can find a way to invest in Southern Colorado to allow more people to be trained and graduate with degrees, to be able to be a part of that continuum of healthcare, the better off our entire part of the state is going to be. So I brought the Capital Development Committee down here more than once, made them look at the old building, and continued pushing. And lo and behold, in 2018, I'm proud to say, this project got moved above the line and funded for $16.8 million. I'm very excited to have, thank you. Yeah. I'm excited to be here today. I got a tour earlier, and I even got a tour of where the nursing program is right now, and wow, what a difference. I don't have to tell you all that. My wife is also a proud alum of the nursing program here at CSUP, and I've been sending her pictures all morning, and she's incredibly proud to see what CSU Pueblo is going to be, what is going to be in the future, and so am I as an alum. So thank you for the vision. Thank you for sticking it out for over 10 years and persisting to get this project done, because this is so vitally important not only to this campus, but to this entire part of the state that oftentimes gets forgotten. So thank you for that, and thank you for allowing me to be here today, and I can't wait to look up this ribbon and see what it does for Southern Colorado. Thank you.
Thank you, Representative Escar. And I mentioned earlier, I wanted the names of all of the members of that Joint Capital Development Committee. I want to take a photo of this building and send it to each of them to close the loop so that they understand decisions that they make. Those decisions impact the quality of education on our campus, and I'm grateful, so thank you. It's my pleasure at this time, let me get my notes here, to introduce Bob Binder from the DLR Group, which is the design firm responsible for this beautiful facility. The DLR Group promises their clients to elevate the human experience through design, and they have fulfilled their promise. Help me welcome Bob.
Can you hear me okay? What a morning here in Pueblo, huh? Yeah. What a great day to dedicate this building. I recognize a lot of faces from when we broke ground here not too long ago. But as the president mentioned, I'm Bob Binder. I'm the leader of the design team, and on behalf of the many architects, interior designers, and engineers involved in this project, we could not be more proud of how this building turned out for you. This design process started in January 2019, so only 18 months on our side of the project. When we started, we had design goals of this needed to be the new home for the health and humanities programs here on campus. And you've already heard about the notoriety of those programs, and we expect those to continue to build. Those programs are really focused on student wellness and academic achievement. Again, elevating the student experience through design. This building is a true collaboration hub for both faculty and relationships that you need here on your campus. Another design goal of this building was to open it up for more daylighting and views and collaboration, ease of accessibility, ease of wayfinding through the building to locate the folks you need to work with to bond on those relationships. And finally, to create a new front door along your wonderful trail and really be an inviting part to that collaborative atmosphere that these programs have created. I would say mission accomplished, huh?
Yeah.
Throughout the design process, we heard a lot of stories from our stakeholder groups about how every student passes through the halls of this building. They have for years, and they will continue to do so. And just how important that is to your campus community. I want to personally thank the stakeholders and the groups involved in all the design meetings. And I really hope that your dreams were made reality through our design here for you. So I know many of you are here today, but thank you so much. It's been our pleasure. The stakeholder group also challenged us to ensure that the CSU Pueblo students deserved more. And I think the results of this project not only reflect that, but this building also now has another 50 plus years of life that for these wonderful programs and to support your wonderful Vision 2028 here on campus. I also want to thank the campus leadership, the facilities group, for all of your mentorship and helping us through this project. I want to particularly call out Mr. Mark Ferrero. Mark, without your collaboration and guidance, this project, we had a great impact on this project, so thank you so much. And then finally to our project partners who helped us bring this project in on budget and on time. I want to thank the Wimber Group. Thank you for all your hard work. And also our design build partner, HW Houston. Nice job. So with that, I'd like to turn this over to Mr. Scott Robb with HW Houston. Thank you.
Did pretty good without having keeping that mask up there, Bob. Thanks, Bob. Good morning, everybody, and thank you for coming this morning and sharing this special occasion for the grand opening for the Center for Integrated Health and Human Inquiry. We began this project in May of last year. Started off a little slow. We were doing a lot of asbestos abatement and kind of turned into some interior demolition, but ultimately the job was to gut and remodel 70,000 square foot of an existing building that was pretty chopped up and pretty old, and then put this beautiful two-story addition here on the west side. And along the way, we had a lot of challenges, and we overcame those challenges through effective communication and teamwork, and we brought this project in so that these students this semester, beginning next week, can occupy, at least in some form or fashion, the building. And it's state-of-the-art, it's modern, it's the simulation labs, it's just going to provide them with a fantastic opportunity. I can't wait for it. My daughter's a junior in the nursing program out here, and she's like, Dad, when are you going to finish this job? We need to go out there and see it, you know? So it's created a lot of buzz and a lot of excitement, and I think all of us remember, I mean, I do, I went to school here too, and I remember the old psychology building, and man, what a transformation. And I can't wait for you all who haven't seen it to see it today. So I too would like to thank our teammates. It's going to start with CSU Pueblo administration, Dr. Tim Mote and his team. CSU Pueblo, all the staff was great to work with. But facilities, you know, I want to call out Royce Kappas, Craig Kaysen, and Mark Guerrero. Wonderful job. Wimber Group, Paul and Matt, thank you. DOR Group, you know, our design build partners, we've done several together. It's a great team. So that's Bob Binder, JD Haarsma, Chris Stum, among some others, and we're proud of those. And all the sub-consultants and engineers, but truthfully, we couldn't have done this without our subcontractor trade partners. Unbelievable. They bought into the schedule, they bought into the pool plan, they bought into the safety program, and we pulled this project off with no recordable incidents regarding safety, and very, very commendable. So, you know, I truly believe that the collaborative management style and teamwork led to this project's success, and I do want to thank and congratulate our project team, Luis Nazario, Ernie Garcia, and Luis Carrillo, and thank them for their many hours of dedication. You know, we at Houston, we're extremely proud of how this project went, how it turned out, and we're extremely proud of our relationship with Colorado State University Pueblo, and looking forward to the next opportunity to do business again. Thank you.
Thank you, Scott. We have partnered with Houston on a number of projects on this campus, and they continue to leave their mark, and every time it enhances the beauty of our campus. We appreciate it. It's my pleasure to introduce Dr. Mohammed Abdul-Rahman, our Executive Vice President of Academic Affairs. He also serves the university as our Provost, which is our Chief Academic Officer. And I remain grateful to Dr. Abdul-Rahman for facilitating numerous conversations with our faculty, allowing the academic vision for this building to emerge. Dr. Abdul-Rahman.
Good morning. Thank you, Mr. President. Well, it was June 2018 when the President asked me to work with a group of faculty on this, and I was so excited. We just finished building a house with my wife, and you know how building a house works, so we're also working with a group of 15 to design a building was definitely going to be an easy task. But it actually turned out to be a great experience. The CSU Pueblo vision is to become the People's University, and being the People's University implies, in my opinion, as the Chief Academic Officer, that we provide our students with a better understanding of people as an underlying theme of all educational programs. The Center for Integrated Health and Human Inquiry is an example of how this will facilitate such an understanding for our students. It will provide a lens, that offers an integral view of academic disciplines focusing on nursing, health sciences, and those that delve into inquiries about everything human, from the humanities and arts to the social sciences. The renovation was designed, as you heard so many times, to encompass spaces that will serve as hubs for interdisciplinary collaboration among faculty and students. The design was a team effort, and with contributions from every academic department represented in the building. We worked as a group, first come up with guidelines that were mentioned in guiding the actual design of the building, but another group actually took that over. And I just want to mention some of the names that were included in both phases of the work. From Mark Guerrero, definitely heard his name, Dr. William Folksted, Dr. Sylvester Calvella, Dr. Carol Faust, Dr. Joe Franta, Dr. Susan Belport, Dr. Crystal Bridgman, Dr. Susan Calhoun-Stuber, Ms. Carol Daughtry, Ms. Sarah Lawson, Ms. Tricia Porcius, Professor Juan Morales, Dr. Arlene Riley Sandoval, Professor Letitia Steffen, Ms. Cordelia Cameron, and Mr. Craig Kaysen. I want to thank all these people. Again, we started facing another challenge. As the project progressed towards conclusion, we faced a challenge in finding a name that reflects the spirit of collaboration, cooperation, and really wanting to serve, the community and the students. We wanted our aim for interdisciplinary endeavors through inquiry and meaningful learning experience to shine through the name. And we also wanted the name to spell out a vision for what we can and want to strive to do. Especially if you want them to fit on one side of the building within budget, and particularly at the end of the project after the budget has been spent. So nonetheless, we persevered. The name went through a lot of evolution process that was contributed again by many beautiful minds, and I especially want to thank Dr. Alegria Rivadeneira and the team that I mentioned earlier for their contribution towards the final vision, which was unanimously agreed to by all tenants of the Center of Integrated Health and Human Inquiry. This is very rarely happening in academic environments, folks, to have a unanimous agreement, so this was great. I believe this final version of the name, the Center for Integrated Health and Human Inquiry, is representative of the new model of learning and collaboration at CSU Pueblo that will be facilitated throughout the renovated building by the innovation of the faculty, staff, and students. Now, it is my pleasure to introduce Dr. Joe Franta, the Dean of the newly minted College of Health, Education, and Nursing, to say more words about the building. Thank you.
Sorry.
It's a new frontier, right? I was asked to just talk a little bit about the process. When the provost came to us and said this integrated concept, we were all kind of thinking, what's this mean? And I can remember when we were approached first about this building even being developed, I thought, oh great, nursing's getting a new whole building. Had to learn to share. And I think in the first part we had 4 subcommittees that worked together for about 6 months to really talk about what this building will do. We all showed up with our wish lists and our wants and our needs, and we also all worked together to refine those so that we could all be here and be integrated. We have student health here, student counseling, nursing, which has had a close relationship over the years, and our students rotate through student health with the nurse practitioner faculty at the moment. We're going to expand that. We talked about a simulation center, and that simulation center isn't just nursing. Simulation is part of all health and beyond. So we've already started some conversations about integrating with social work, for example, or we already have a relationship with business and how we can tie those together. Certainly our community partners are important as well. We hope to think that we'll have a relationship in the near future with Parkview that we integrate with them somewhat so that we can teach all of our students, their staff, in a collaborative manner at multiple sites. And we're really excited about working in that direction. The building came out, I've got to compliment really DLR, Houston, Wimber, lots of little hiccups that happen in a project this big, and what I noticed is everyone came together, we focused on the resolution of the problems that we were encountering, and now we have something that we can really be proud of. So thank everyone that participated in this, and there's so many names that I could like to mention, but those are the few highlights. Also, at this time, I would like to have our 2 new doctors stand up, Dr. Katie Fechteral and Dr. Ron Dorndorf. And the provost is going to come up and say a few words, and we have a little something for them.
Sorry again, managing the masks now is part of our learning experience. So it is my pleasure to introduce our first 2 doctoral graduates. And I want to start with Dr. Katie Fechteral. Dr. Fechteral obtained her bachelor's, master's, and now her doctoral degree from Colorado State University, Pueblo. She has dual board certifications in adult, gerontology, acute care, and family nurse practitioners. She has been practicing at Pueblo Balmonary Associates since 2014. Prior to her career as an NP, she accumulated a background in oncology and gastro. Complete her goal of obtaining a DNP with the support of her family and friends. Born and raised in Pueblo, Colorado, she's proud to be one of the first 2 doctoral degree recipients of Colorado State University, Pueblo. Dr. Fechteral, would you come forward and just... Our second graduate is Dr. Rhonda Orndorf. She has been a nurse practitioner since 2014, graduating from Colorado State University, Pueblo with her master's in nursing, with dual certification in adult, gerontology, acute care, and family nurse practitioner. She started her career as a cardiology nurse practitioner with Pueblo Cardiology Associates. During her time with the cardiology group, she obtained her associates of the American College of Cardiology, a designation recognizing cardiovascular team members dedicated to high level of cardiovascular care. Currently, she works at Parkview Medical Group's internal medicine office at Park West. as a primary care provider. Her doctorate work focused on obesity and diabetes management in the primary care setting. Prior to her role as a nurse practitioner, she worked as a registered nurse after graduating from the prestigious Beth El College of Nursing in 2007. Rhonda is also an adjunct professor for the Master's Nurse Practitioner Program at Colorado State University, Pueblo. Please come forward. Thank you. So I just want to say a couple of things about DNP. The DNP program is a professional degree that focuses on evidence-based healthcare. The program prepares graduates, to create and lead new models of healthcare delivery for communities locally and across the nation. It offers a career advancement opportunity for experienced nurse practitioners and nurse educators. We have seen examples of this just today. So I'm also glad to say that the School of Nursing, actually the College of Health Education and Nursing, has been on a pathway to add other degree programs, graduate degree programs with creating opportunities for career advancement. The latest is a degree in a master's degree in nurse manager and leader. And the Center for Integrated Health and Human Inquiry, with its expanded state-of-the-art simulation lab facilities, opportunities for experiential learning in a clinical setting, provides the space, equipment, software, and technology resources to teach and evaluate both undergraduate and graduate nursing skills with real patient care and other related experiences, both common and high-risk situations, to promote safe patient care in clinical settings. Thank you all. I'm so proud of this day. Thank you.
Thank you, Dr. Abdul-Rahman, and also Dean Franta. Thank you for your remarks. And again, congratulations to our students. And there's another faculty member I just want to recognize, Susan Belport, I believe is with us, maybe not, but I know Susan played a role in, thank you, Susan, for guiding both of our doctoral students through their process. I'd also like to just recognize today we have with us Representative Donald Valdez representing District 62. We want to thank you for joining us. Representative Valdez, wherever you are, good to see you. Before we do the ribbon cutting, whenever you have an event like this, there's a number of folks who are responsible for working the magic behind the scenes. You know who you are, and I know who you are, and I appreciate all of you being here and helping us make this day a reality. So thank you. A round of applause for Tracy Samora and company for making this event a possibility. To my left are our students who have scissors. That looks a little bit dangerous. We'll be also providing some tours of the facility after we cut the ribbon of the building. Once that is completed, we invite all of you to seek out one of these individuals, and in small groups of 10 or fewer, they will be giving tours of our facility. So make sure you stick around and get a tour of the facility. At this time, we're ready to cut the ribbon and to open this building so we can begin instruction on Monday. So I'd like for Dr. Abdul-Rahman and Dean Franta, if you would join us up front along with Representative Esgar. If you could join us, please. And then from Phyllis Zamora, from our Chamber of Commerce's Stephen Trujillo and Amy Gasparetti. Scott Robb, if you could join us. Bob Binder, Dr. Orndorff, and Dr. Fectorelli, if you could join us, please, as a part of this history-making moment, and also Craig Kaysen. Craig, if you would join us at the ribbon with the scissors to help open our new facility. Here we go. Are we ready? We'll do a 5, 4, 3, 2, 1, and we'll cut on 1. Great. Yes, please. Okay, are we ready? So 5, 4, 3. Thank you for being with us. Thank you.
Good job, Mike.
Good. How are you doing? Yeah. Thank you. Very much. Everyone, if we could keep, for those who have Anybody want to